Hello everyone, in today's video we are going to learn how to measure uterus. Uterine size varies depending upon the patient's age, menstrual status and gravida. In nulliparous adult woman, the length of the uterus is usually less than 8 cm, width is usually less than 5 cm and its anterior-posterior diameter or height is usually less than 4 cm. Parity generally increase the size by 1 cm in each dimension. After menopause, uterus atrophies and the length of the uterus can range from 3.5 to 6.5 cm and its epidiameter or height is usually in between 1 to 2 cm. Remember friends, we take measurements in 3 dimensions: length, height and width, because bladder filling can artificially increase the uterine length. Now this is the mid-sagittal view of the uterus and this is the transverse view of the uterus. We take length and height in mid-sagittal image, while we take width in transverse. Uterine length is measured from outer serosal surface of the fundus to the external cervical os. Here in this image you can see this is the outermost part of the uterine fundus and here is the external cervical os. So we take length from fundus to the external cervical os. So this is the length. Similarly, we take the height or anterior posterior diameter of the uterus in mid-sagittal plane from outer to outer serosal surface. So this is the height of the uterus. Uterine width is measured in the transverse plane like this. Remember the rule of 8-5-4. 8 length, 5 width and 4 is height of the uterus. Uterine cervix length is measured in the mid-sagittal plane from internal os to the external os. Cervix extends from external os to internal os. Internal os is the point where cervical canal opens into uterine cavity. Similarly, external os is the junction between vagina and uterus. It may be difficult to separate uterine body from the cervix in ultrasound. However, if you compare the myometrial ecotexture, myometrium around the cervix is usually denser and more homogeneous, but the myometrium around the uterine body is usually heterogeneous. Endometrial strip in the uterine body appears as a bright hyperechoic line that runs through the center of the uterus. On the other hand, cervix usually lacks this central line, which may help to differentiate between uterine body and cervix. We often find angulation in between uterine body and cervix. So this angulation sometimes helps to differentiate uterine body from cervix. In reproductive stage, if you compare the length of the uterine body to that of cervix, the ratio will be almost equal to 2:1. And in case of postmenopausal stage and in pediatric stage, the ratio of the length of the uterine body and that of cervix is usually 1:1. There are various causes of uterine enlargement. One of the most common cause of uterine enlargement is normal intrauterine pregnancy. Molar pregnancy or postpartum uterus can be larger than usual. Hormonal causes like exogenous hormones can cause bulky uterus. Myometrial, endometrial tumors also can lead to enlarged uterus. Diffuse adenomyosis, uterine adenomyomas, hematometra, uterine EB malformations and pelvic congestion syndromes, all of these can lead to enlarged uterus.